Apologies. Deputy Councillor Connolly. Gomaniscéil tá brúnar an
Gormagad ceantóla agus fáiltíim Reverend Jesh a bheith páirteach sa díosborach seo agus mo bhuichas tá sin féin tá an táhar agus an rún har a bheith táhachtach banan sé le cuasaí sláinte, banan sé le Asperfornia agus banan sé leis an crúcás ina bhfuil ar seirbhísí sláinte faoi láthair. Agus tá sagam ar go bhfuil do crís an áit ceart agus tá sagam go bhfuil do dhíhall á dhéanamh agad cuile lá ní léil amhras faoi sin ach tá géarcéim an le fad an lá agus ní dóil am inis gur bé géarcéim an focail ceartaí ná ire mar tá sé an có fada sin tá sé deachar glacu leis agus sin an fá go rá costa trasforte i gceist sin an fá gur feilsiú túrascáil chun doling glet le na feibanna ar bhain córasach onas nach maimmuide an seo cuili seachtain ag gearán faoi códonna is atá rudaí ar an talamh. Agus tá méid smaoinemh ar gaile agus tucha mé reis go dtí na pointe generalta agus aniu i ngáile bhí dachad sé duine ar tralaithe agus ina meisiúd bhí sé fáiste déag. Cúpla lá hin bhí ceire chuige cethar othair ar tralaithe. So ní le nachrú beidir figur beag ach an aib céine lá I ní le de bhar na géarcéime atá an agus de bhar aspatella I ná rire ar level an córas dul in glet leis an bhaib I meallach atá inmharana agus I meallach atá tiltte ag gach duine sa tír. Tá sé tiltte aganne seirbhí sláinte a bheith agan mar cheart, mar one cart. So, Minister, I welcome and I've thanked Sinn Féin and I'm not going to repeat my thank you to them and it's a very important motion and I look at it in the context of Galway as we all do when we stand up here, but to make general points. On the very first day I was elected and when the independents were negotiating for an extra facility in Waterford or Wexford, I made the point that a heartbeat down there is equally as important as a heartbeat in Galway and that we're not here to fight our corners, we're here to provide public services, to hold the system to account and ensure that every single county has the appropriate services. And we're far from that in Galway, even though it is often said that we're the centre of excellence for cancer care services. We serve a population of 1 million people from Donegal down, almost 1 million, and we have a system that's creaking at the seams. The previous clinical director in the hospital, whose name escapes me, maybe it wouldn't be appropriate to name him in any event, was on record of saying he couldn't stand over any more cutbacks because they were simply too dangerous and a threat to patient safety. That person has gone on to different things and the situation hasn't changed. It simply hasn't changed. And so on a general level, we need a proper plan. You know, we have so many problems and we have so many assets and so many solutions. It's very difficult sometimes, Minister, and I'm sure you're finding that really with your hands-on approach. So we have 150 acres in Merlin Park Hospital. And we have what I would describe as a higgledy-piggledy development of further services without an overall master plan. And you think we would have learnt our lesson from the congested regional site, but we haven't. And we're still progressing in that manner, notwithstanding that I and various colleagues here put pressure on the system to see when was the options report coming out. And we got an options report and they recommended a brand new hospital in Galway in Merlin Park. And theoretically, wonderful idea, but then we went ahead with bits and pieces. And we were in, and I talked about the analogy of the Russian dolls and a temporary accident and emergency with then a temporary building with the view to have an accident and emergency in 2026. And if my memory serves me correctly, that was almost the same Spruchgott or the same time that we would have built a new hospital in Merlin Park. So that's the background. And that's the system. And then I have a letter here, lots of reasons why hospitals are under pressure, why nurses are under pressure, why staff are under pressure. And I've always been uncomfortable. And I regret actually standing up, clapping. It was something I joined in with. We should have paid tribute to everybody. The cleaners in the hospital should be top of the list, actually, when we thank anyone, and the porters, along, of course, with the nursing staff and the doctors. But when we distinguish, we divide. And we need to make meaning, to give meaning back to words, that we are all in this together. And so we're all in this together. We look at all the analysis and reports that we've had, and we see the hospital in Galway is under pressure for many reasons. It's too old, it's too congested. On top of that, there are people in hospital that shouldn't be in hospital. So I have an answer here in Gaeilge, and I want to thank the Minister. I don't often thank him, Minister Connolly, but through his intercession, we've got replies. And the reply tells me that Ilor in the Gaeltacht in Connemara, in the middle of the Gaeltacht in Connemara, we have no respite services at the moment, and we have no daycare at the moment for different reasons. The daycare apparently is because they're in the process of re-registering, but we learned they've had no daycare in that public facility since March 19. And I had to push, and the Minister got the reply for me and so on. So that puts extraordinary pressure, not just on the families who are caring for their loved ones, but also on the hospital system. The primary care system has never caused great problems. It led to a departure of Deputy Shortall from the Labour Party at the time because of the utter failure to roll out primary care in a just and fair manner. And we're still exactly, if not worse, at that spot. And so we have COVID now, and we have a motion about nurses that we couldn't but agree with. But again, what does the language mean when the government says, we agree with this motion? Sorry, I don't know if they went that far. We don't disagree with the motion, I think. So does that mean that there are only five demands, 5 bullet points on the Sinn Féin motion? One is the booster programme, and I hear clearly that that's going to be made available to the staff if they wish it. Then they asked for the publish and to act on the McHugh review. Is there a clear answer on that? Are you going to publish the McHugh report? Is that what the government means when they say they accept this motion? Are you waiving the registration and retention fees which are coming due? Are they going to be waived? And engage meaningfully and positively with health. And I gather that's what you're going to do. And I can't see how you're going to wrap up mental health supports for healthcare workers, although I fully support it because the state of mental health, as you well know and you've inherited, is really, really at an all-time low, and we might come back to that to another day. So when we look at all of this then, and we go by way of motions and repeated motions, which after a while I'm very grateful for, and I'm grateful for the opportunity to discuss it, they become tiresome to those listening to us because they're saying to us, what are ye doing? So it took the Sinn Féin motion and the support of all of the Dáil and a protest outside today to find out that you were going to follow some of the recommendations. And I listened carefully when the Minister was talking. So how many recommendations were there? We don't know. We actually don't know how many recommendations. So when he tells us he's going to implement some of them, well, we'd like to judge that. And more importantly, the nurses and the student nurses would like to judge that so that we can see it in context. And what jumps out at me here today is the Irish Nurses and Midwives Organisation press release. Today's demonstration is not just about the pay and conditions for student nurses and midwives. It is about the future of our healthcare system. Now, that really jumps off the page at me, that it's about the future of our healthcare system, not just about pay and conditions, which need to change and need to be improved. And again, you see language where we can never go back to where we were. Climate catastrophe is facing us, and COVID. And so repeatedly we've heard this wonderful language from the spin doctors who write, I wish, Minister, there were more like you that stood up and actually just said it as it is. It's the biggest change that I've seen with one or two of the ministers, and the rest are resorting to spin and words, like we had a discussion last week on reconstructing and reconnecting, when really we should have been talking about human rights in relation to the COVID restrictions and so on. So language means nothing. And really, that is the most frustrating thing for people and the most dangerous thing for democracy, when language means nothing. We'll be on your side because you're working hard. I mightn't agree with your ideology. I mightn't agree with certain things. But it's my job to set that out and say why. So tonight I'm listening to this, and I hope that you bring some clarity and tell us, is the McHugh report going to be published tomorrow? Are the fees going to be waived? And all of the other 3 or 4 other requests that are there. Is that the result of this motion tonight, so that words mean something and democracy means something? Very much.